What if I told you the pills you take every morning to stay healthy could be putting quiet stress on your liver, and you might not notice until real harm has already started? A 2023 JAMA internal medicine study found nearly 1 in 5 adults over 65 show early medication-related liver changes, often missed until later. Your liver processes every medication you take. The more you're on, the heavier the load. In that same study, liver changes were 3 times more common in people taking 4 or more daily meds, yet fewer than 15% had routine liver tests. Today, you'll learn 5 early, often overlooked signals, small shifts in energy, skin, or digestion many dismiss as just aging. Noticing them gives you real power to act early. Everything we share is science-backed. Talk to your doctor before making changes. Everybody is different. Small steps matter more than perfect ones. Number 5, unexplained fatigue that doesn't improve with rest. Your liver helps turn food into energy. When it's working harder, like from processing several medications, that process can slow. You might sleep well, but still feel drained by mid-morning. Evelyn, 68, a retired school teacher, took a statin, a beta blocker, and low-dose aspirin daily. She blamed her constant fatigue on aging until her doctor checked her liver enzymes. Her ALT was 68, above normal. They lowered her statin dose and added a short trial of milk thistle under supervision. In 6 weeks, her energy returned. She said, "I walked to the park again and didn't need a nap afterward." A 2024 review in Hepatology Communications found 61% of older adults with mild liver changes first noticed fatigue, and 74% improved with simple, guided steps. One gentle shift: ask for a basic liver panel, ALT, AST, ALP, and bilirubin at your next visit. Number 4, persistent itching, especially on palms or soles. This isn't dry skin or an allergy. When the liver struggles to move bile, bile acids can build up and cause deep, persistent itching, often on the palms or soles, worse at night. Raj, 72, tried lotions and antihistamines for months. His dermatologist checked his GGT. It was 118, nearly double normal, likely from long-term ibuprofen use. They switched him to occasional acetaminophen, less than 2,000 milligrams per day, and added soluble fiber. His itching faded in 4 weeks. A 2023 Mayo Clinic study found 1 in 8 older adults on regular NSAIDs had similar symptoms, and 89% improved after a medication adjustment. If itching lasts more than 2 weeks with no rash, ask for a GGT and alkaline phosphatase test. Number 3, dark urine plus pale stools together. Bilirubin, a yellow pigment made when old red blood cells break down, is processed by the liver and sent to the intestines. If the liver is strained, bilirubin backs up. Your urine turns tea-colored. Your stools lose their normal brown shade and look pale or clay-like. Maria, 64, noticed this after starting a new antibiotic for a sinus infection. She called her doctor right away. Blood work showed elevated bilirubin and ALT. They paused the antibiotic, and her levels returned to normal in 3 weeks. A 2022 study in Digestive Diseases and Sciences found 92% of early drug-induced liver cases in adults over 60 appeared in this combination, and catching it within 72 hours prevented further injury in nearly all cases. Your body is asking for quick attention here. Contact your provider within 48 hours if you see this pair of changes. Number 2, abdominal swelling or right side heaviness. The liver sits just under your right rib cage. When it becomes inflamed or holds extra fluid, you may feel full quickly, notice your waistband tightening, or sense a dull pressure on the right side. Not sharp pain, just a persistent weight. Thomas, 70, blamed his expanding belly on holiday eating. His primary care doctor ordered an ultrasound after he mentioned the discomfort. It showed mild liver enlargement, likely from long-term use of metformin and omeprazole. They adjusted the timing of his doses and added 1,000 milligrams of omega-3s daily. His bloating eased in 8 weeks. Research from Johns Hopkins in 2023 linked this symptom to early fatty liver changes in 34% of older adults on multiple medications, and 81% improved with modest lifestyle and medication tweaks. Track your waist measurement weekly. If it increases more than 1 inch in a month without weight gain elsewhere, it's time to look deeper. Number 1. Easy bruising or bleeding that takes longer to stop. Your liver makes clotting proteins. When it's under strain, even a light bump can cause bruising, or a small cut may take longer to stop bleeding. Helen, 66, noticed purple marks after grocery shopping. Her pharmacist found she was on warfarin, low-dose aspirin, and a sleep aid with diphenhydramine, a combo that raised her INR. They stopped the sleep aid and added consistent vitamin K-rich greens. Her bruising stopped in 2 weeks. A 2021 Annals of Internal Medicine study found 40% of older adults on blood thinners unknowingly used another medication that increased bleeding risk. One gentle shift. Schedule a yearly medication review with your pharmacist. Bring every pill, prescription, over-the-counter, and supplement. It takes 20 minutes. It can make a real difference. You might ask, can I still take my meds if I notice one of these signals? Yes, but talk to your doctor or pharmacist first. A 2021 Annals of Internal Medicine study found 40% of adults over 65 were on at least one med that could be safely adjusted, like lowering the dose or switching to a gentler option. Another concern, what if I've taken these meds for years? Is it too late? No, the liver can heal. A 2024 hepatology study showed 78% of older adults with early changes returned to normal function within 6 months, often with just 1 or 2 small adjustments. Your body is listening. It's never too late to support it. So to recap, watch for 5 signals. Fatigue rest doesn't fix. Unexplained itching, especially on palms or soles, dark urine with pale stools, pressure under your right ribs, and easy bruising. These aren't failures. They're early, gentle cues, your body asking for support. You can act. Request a liver panel at your next visit. Review all meds, including over-the-counter, yearly with your pharmacist, and tune in to small changes. Small steps today help you stay active, independent, and present in the life you've built. Have you noticed any of these 5 signals and thought it was just part of getting older? What's the one medication you've taken the longest and wonder if it's still the best fit for you today? Share your experience in the comments. Your story might help someone else feel seen or take that next step. If this feels helpful, please like, subscribe, and hit the bell. New science-backed tips come out every week because after 60, health isn't a luxury, it's the foundation.